It was beyond belief that children in Flint, Michigan, in the United States of America in the year 2016 are being poisoned.
What is more important than the health and well-being of the people, particularly children? It is raining lead in Flint, and the state is derelict in not coming forward with the money that is required.
I want the truth, the whole truth, and nothing but the truth.
For the simple reason that they wanted to save money.
It was absolutely the state that was at the center of what went wrong in Flint. It was our emergency manager appointed by our governor.
Bureaucrats created a culture that valued technical competence over common sense. And the result was lead was
insufficient information to understand the
this was a
potential
failure.
scope of the
Government
lead
at all
problem
levels.
until more than a year after that water supply was
Governor
switched.
Snyder, do you admit that you personally received a letter on January 18, 2015 from Flint's mayor begging you to take action?
We only really have to listen to the 1% who put us into office.
Well, the quality of the state's response has been very poor. The state just has not been reacting urgently to what is an urgent issue in Flint. One of the first questions people had was, well, how damaged am I? How damaged are my children? How long-term are the effects of lead? Is there anything we can do to prevent it from getting worse or make it better? And so all of those questions require healthcare expertise and healthcare investments. First, there's the assessment work, and then there's the actual provision of care. And then in addition to all of that, you've got the mental health care that is a part of the Flint water crisis because of the trauma that people in Flint have been feeling. We've expanded Medicaid coverage to people in Flint up to 400% of the poverty level, which is a significant expansion of service to folks who are struggling to pay for it. But the quality, and not so much the quality, but rather the quantity of mental health services that are available under Medicaid are pretty limited. Now when it comes to mental health, the people of Flint are, if they're a part of this expanded Medicaid program, going to have some access. The question is, how can we make sure that that access is what it needs to be? Because the limits that you have in terms of the number of visits and whatnot are fairly stringent and may not be at the level of quantity that is required to get people in Flint back on track. We need to rebuild the trust by getting in there and fixing the core of the problem. We need to provide more wraparound support. And the final thing we need to do is address the daily stress that people are being put into as a result of having to chase water all the time. Right? Where's that next pallet of water? Where's that next case of bottled water coming from? How am I going to pay for it? Where am I going to get it from? Taking that stress out of the daily lives of Flint residents could really lift a lot of stress off of their mind and improve their mental health as well.